Heart failure isn't just a medical term, it's a silent and growing crisis. Today, more than 6 million adults in the U.S. live with this condition, and that number keeps climbing. Once seen only in older adults, heart failure is now appearing in younger people, hitting minority communities the hardest. According to the Heart Failure Society of America's 2024 report, the trend is alarming. Death rates are rising, and the CDC warns that half of those diagnosed die within 5 years. But here's the truth: your body gives you warnings long before it breaks down. It doesn't shout, it whispers. Maybe it's fatigue, swelling, or that breathless feeling you blame on age or stress. Those whispers could be early signs your heart needs help. This isn't about fear, it's about empowerment. Because with awareness and early action, heart failure can be managed and your story can change. In this video, you'll discover the 12 early signs of heart failure that can save your life. Sign number 1, shortness of breath on exertion, dyspnoea on exertion. Our first and most common early warning sign of heart failure is shortness of breath during physical activity, medically known as dyspnoea on exertion. If you notice yourself getting winded, climbing stairs, walking across a room, or doing chores that used to feel effortless, that's not just getting older or being out of shape. It could be your heart struggling to meet your body's oxygen needs. Here's what's happening inside your body. Your left ventricle, the heart's main pumping chamber, becomes weaker and less efficient. It can't pump enough blood forward with each beat, so blood begins to back up into the lungs. As pressure builds, fluid seeps into the tiny air sacs where oxygen exchange happens. The result? That uncomfortable, heavy, breathless feeling as if you just can't get enough air. At first, it might only happen with exertion, walking briskly, climbing stairs, or exercising. But over time, if untreated, breathlessness can appear even during mild activity or rest. Research shows that about 85% of people with heart failure report this symptom at the time of diagnosis. Unfortunately, many dismiss it as normal aging, stress, or lack of fitness, delaying treatment until it's much harder to reverse. Here's my advice: pay attention to your baseline. If daily tasks suddenly feel harder or you find yourself pausing to catch your breath, don't ignore it. It's not weakness, it's a warning. Early recognition of this single symptom can lead to treatment that improves your heart function, your energy, and your life expectancy. If you're stopping more often to catch your breath, see your doctor. Sign number 2, orthopnea, difficulty breathing when lying flat. The second warning sign of heart failure is orthopnea, which simply means difficulty breathing when lying flat. If you find yourself stacking multiple pillows to sleep comfortably or waking up short of breath whenever you lie down, this isn't just about comfort or habit, it's a warning sign. Your heart may be struggling. Here's what's happening. When you lie flat, gravity causes the blood that's been pooling in your legs and abdomen throughout the day to flow back toward your chest. For a healthy heart, that's no problem. But if your left ventricle, the main pumping chamber, is weak, it can't handle that sudden increase in blood returning to it. The extra fluid pressure then backs up into your lungs, creating pulmonary congestion, a heavy, suffocating feeling that makes breathing difficult when lying down. Sitting upright or using extra pillows helps temporarily because gravity pulls the fluid back down, giving you some relief. But remember, this doesn't solve the underlying issue. Orthopnea typically appears in more advanced stages of heart failure, often classified by doctors as NYHA Class 3 or IV, where even simple activities or resting positions can trigger symptoms. Here's the red flag. If lying flat makes you breathless, or if you sleep better sitting up, it's time for immediate medical evaluation. Don't dismiss it as just aging or sleep discomfort. Your heart is sending a clear distress signal. Catching this symptom early can prevent further progression and even save your life. Needing more pillows to sleep or waking up breathless? Talk to your doctor. It's not just discomfort, it's a warning. Sign number 3. Peripheral edema, swelling of feet, ankles, and legs. One of the most visible and commonly ignored warning signs of heart failure is swelling in your feet, ankles, or lower legs, what doctors call peripheral edema. If your socks or shoes feel tighter by evening, or if pressing your finger into your ankle leaves a soft dent that lingers, that's not normal swelling. That's pitting edema, and it's your body's way of telling you your heart is under strain. Here's what's happening. When the right side of your heart can't pump blood forward efficiently, blood begins to back up in your veins. That increased pressure pushes fluid out of the blood vessels and into the surrounding tissues. Gravity naturally pulls that excess fluid down toward the lowest parts of your body, your feet and ankles, making the swelling worse as the day progresses. This type of swelling is different from what you get after standing too long or eating salty food. Cardiac edema tends to be symmetrical, soft to touch, and persistent. It may ease slightly overnight when your legs are elevated, but it never fully disappears. Clinical studies show that around 75% of people with heart failure develop this symptom, often after other early signs like breathlessness or fatigue have already appeared. Here's my advice. If you're noticing swelling that keeps returning, or it's paired with shortness of breath or sudden weight gain, don't ignore it. Elevate your legs, track your daily weight, and call your doctor if you gain more than 2-3 pounds in a day. Because swelling isn't just extra water, it's your heart sending a clear message. I need help. Sign number 4. Persistent cough or wheezing. Here's a symptom that often catches people by surprise, a persistent cough or wheezing that doesn't go away. Most assume it's allergies, asthma, or a lingering cold, but in many cases, it can actually be your heart trying to tell you something. When your heart can't pump blood efficiently, fluid begins to back up into the lungs. This fluid buildup irritates the airways and triggers a constant cough, what doctors call a cardiac cough. Usually, this cough is dry and nagging, but in more advanced cases, it may produce pink, frothy sputum, a combination of air, fluid, and tiny traces of blood. This particular symptom is a medical emergency, as it signals significant fluid accumulation in your lungs, known as pulmonary congestion. Unlike asthma or respiratory infections, a cardiac cough doesn't respond to inhalers, allergy medications, or cough syrup. You might also notice a faint wheezing sound when breathing, not because of airway inflammation, but because air is struggling to move through fluid-filled passages. This cough often worsens at night or when lying flat and tends to improve when you sit upright, another subtle sign pointing toward heart involvement rather than a lung condition. If you're coughing persistently, without any sign of infection, feeling breathless, or waking up at night needing to sit up just to breathe, it's time for a heart checkup. Cough or wheeze that doesn't improve with treatment could be your heart, not your lungs. Because sometimes the symptom you think is coming from your chest is actually starting from your heart. Sign number 5. Fatigue and weakness. We all get tired, but heart-related fatigue feels very different. It's not the kind of tiredness you shake off with a nap or a weekend of rest. It's deeper, more persistent, and it lingers no matter how much sleep you get. This is one of the earliest and most commonly overlooked signs of heart failure. People often describe it as, "I just don't have the energy I used to." Tasks that once felt simple, showering, carrying groceries, climbing stairs, suddenly feel like they take everything you've got. Here's why. When your heart weakens, It can't pump enough oxygen-rich blood to meet your body's needs. That means your muscles, your brain, and your organs are all running on low fuel. You might feel lightheaded, weak, or mentally foggy, and no amount of rest seems to bring your energy back. Research shows that nearly 90% of people with heart failure experience this kind of fatigue, often months before other symptoms become obvious. Yet many dismiss it as just aging, stress, or overwork. But here's the truth. You know your body better than anyone. If you've noticed a steady drop in your stamina, if daily activities leave you drained, even when you've slept well, that's not normal. It's your body warning you that something deeper is going on. Remember, your energy is a reflection of how your heart performs. Spotting this symptom early can give your heart and your life a second wind. Don't ignore exhaustion, decode it. Sign number 6. Paroxysmal nocturnal dyspnea. Imagine this. You're fast asleep when suddenly you wake up gasping for air, your heart pounding, and a wave of panic rushing through your chest. You sit up, struggling to breathe, and slowly, the air comes back. That frightening experience is called paroxysmal nocturnal dyspnea, or PND, and it's a classic warning sign of heart failure. Here's why it happens. During the day, fluid collects in your legs and abdomen because of gravity. But when you lie down to sleep, that same fluid redistributes upward toward your chest and lungs. For a healthy heart, that's manageable. But for a weakened heart, especially the left ventricle, that sudden volume shift becomes overwhelming. The heart can't keep up, and fluid seeps into your lungs, triggering sudden shortness of breath. PND typically occurs 1 to 3 hours after falling asleep, and while sitting upright or standing helps relieve it, that relief is only temporary. The problem isn't your lungs, it's your heart struggling to handle circulation changes. Many people mistake these episodes for asthma, sleep apnea, or anxiety attacks, but if you're waking up gasping or needing to sleep sitting upright, that's not normal. It's your heart sending a distress signal. Nighttime breathlessness is never just a sleep issue, it's an urgent red flag. If this is happening to you, don't wait for another episode. See your doctor immediately. Acting early can prevent a crisis and protect your heart before things worsen. Sign number 7. Jugular venous distension. Let's move to a sign that your doctor might detect before you do jugular venous distension, or JVD. This appears as visible bulging of the veins in your neck, especially when you're sitting or reclined at about a 45 degrees angle. It might look subtle, but to a trained eye, it's a major clue about what's happening inside your chest, specifically how well your heart is handling blood flow. Here's why it matters. When the right side of your heart can't pump blood forward efficiently, pressure starts building up in your veins. That backed up pressure travels upward, causing the jugular veins, which run from your heart to your neck, to become swollen and distended. This isn't something you can usually spot yourself, but your healthcare provider will look for it during a physical exam. They may even perform a hepatojugular reflux test by gently pressing on your abdomen to see if the neck veins bulge further. If they do, it's a strong indicator that your heart is struggling to manage blood return. JVD typically signals moderate to severe heart failure, showing that the heart's pumping function has weakened enough to cause systemic fluid overload. It's an important finding that guides treatment decisions, such as medication adjustments or further cardiac testing. Even though you may not see it yourself, your doctor can, and that's the beauty of a thorough checkup. These small observations can reveal what your body's been trying to communicate all along. So, never skip your regular visits, they're your heart's best defense. Sign number 8. Pulmonary crackles. Sometimes your heart struggle can actually be heard not by you, but by your doctor. These subtle sounds, called pulmonary crackles or rales, are fine crackling or bubbling noises heard through a stethoscope, most often at the base of your lungs. Here's what's happening inside your body. When the left side of your heart becomes too weak to pump blood efficiently, fluid begins to back up into your lungs. This fluid seeps into the tiny air sacs, the alveoli, where oxygen should be exchanged. When air passes through those partially fluid-filled sacs, it produces that faint crackling sound your doctor listens for. In the early stages of heart failure, these crackles are usually heard only during deep breaths and limited to the lower lung areas, where fluid collects first. But as heart failure progresses and more fluid accumulates, the crackles spread upward and can even be heard during normal breathing. You won't be able to hear them yourself, and you might not even feel them, but to a trained clinician, pulmonary crackles are one of the most telling signs of fluid overload and heart strain. These sounds aren't caused by infection or inflammation like pneumonia. They're a direct result of congestive heart failure. What your doctor hears through a stethoscope today could prevent tomorrow's emergency. Don't underestimate the power of a regular checkup sometimes. It's the quietest sounds that speak the loudest about your health. Sign number 9, third heart sound. Here's a fascinating and often misunderstood clue. Your doctor may detect an extra sound in your heartbeat, known as the S3 gallop. Normally, the heart produces two familiar sounds, lub-dub. But when heart failure begins to develop, doctors may hear a third, softer sound immediately after the dub. This creates a distinct rhythm, lub-dub-dub, resembling the gait of a galloping horse, which is why it's called a gallop rhythm. Here's what causes it. During the phase when your heart relaxes and fills with blood, called diastole, a weakened or overfilled ventricle can't handle the incoming blood efficiently. As blood rushes into this stiffened chamber, it creates subtle vibrations that produce the S3 sound. This finding is more than just an unusual rhythm, it's one of the earliest and most specific signs of heart failure. Research shows that the presence of an S3 gallop indicates increased filling pressure and volume overload, even before outward symptoms like swelling or breathlessness appear. You won't feel this change, and you can't hear it yourself. Only a clinician using a stethoscope can detect it. But if your provider mentions an S3 gallop, take it seriously. It's your heart's way of saying it's working harder than it should and needs medical attention or adjustment in care. Think of it this way: your heart has started speaking in a new rhythm. When your doctor hears that extra beat, that's your cue to act early, lighten the heart's load, and protect your health for the years ahead. Sign number 10, rapid weight gain. Here's one of the most overlooked warning signs of heart failure: rapid weight gain. If you step on the scale and notice you've gained 2 to 3 pounds in a single day, or 5 pounds within a week, that's not body fat, it's fluid retention. And it's one of the clearest indicators that your heart is under stress. Here's what's happening. When the heart weakens, it can't pump blood as efficiently as it should. In response, your kidneys retain extra sodium and water, trying to compensate for the reduced circulation. But instead of helping, this leads to fluid buildup throughout your body, in your legs, abdomen, and even around your lungs. The result is a fast, noticeable rise in weight. Each pound gained represents roughly half a liter of retained fluid. So a 5-pound jump could mean an extra 2.5 liters of fluid your heart is now struggling to move. That's why doctors emphasize daily weight monitoring as one of the most reliable home tools for tracking heart health. Weigh yourself every morning, after using the bathroom, and before eating, ideally at the same time and in the same clothing. If you notice a sudden spike, don't ignore it. Contact your healthcare provider right away. Acting quickly can help prevent hospitalization and stop fluid overload before it becomes life-threatening. Remember, your scale isn't your enemy. It's your early warning system. Small changes on that screen could be your heart's way of saying, I need attention now. Catching it early can save your heart and your life. Sign number 11. Hepatomegaly, liver congestion. Now, let's look at a less obvious but very important sign of heart failure, hepatomegaly, or liver congestion. When the right side of your heart can't pump blood efficiently, pressure begins to build up in the veins that carry blood back to the heart, including those connected to your liver. Over time, this backup of blood causes the liver to become enlarged, swollen, and tender. You might feel a dull ache or a sense of fullness under your right rib cage, especially when bending forward or taking a deep breath. Some people experience loss of appetite, nausea, or feeling full quickly after eating small portions. It can also make your clothes feel tighter around the waist, not because of fat, but because your abdomen is slowly filling with trapped fluid. This isn't a digestion or stomach problem, it's a circulatory issue. Your liver becomes engorged with blood because your heart isn't strong enough to move it forward effectively. As a result, your liver starts to swell, causing discomfort and sometimes even visible bloating. Clinically, liver congestion usually appears in advanced stages of heart failure and often accompanies leg swelling, edema, or abdominal fluid accumulation, ascites. If you notice these symptoms, don't ignore them. Remember, your organs are deeply connected. When your heart struggles, your liver speaks up too. Recognizing that message early and acting on it can prevent serious complications and help you start healing sooner. Sign number 12. Ascites, abdominal fluid accumulation. Our final sign and one of the most serious indicators of heart failure is ascites, or fluid buildup in your abdomen. This condition develops when severe heart failure causes pressure to rise in the veins that return blood to your heart. That pressure forces fluid to leak from your blood vessels into the abdominal cavity, the space between your organs and your abdominal wall. You might notice persistent bloating, a heavy or distended belly, or the feeling of being full even when you haven't eaten much. Your clothes may suddenly feel tighter around the waist, and it may seem like you're gaining weight, but this isn't fat or digestion related. This is fluid accumulation, and it's a strong signal that your heart's pumping capacity has been significantly compromised. Unlike normal bloating, the swelling from ascites doesn't come and go. It worsens gradually and can cause visible abdominal distension, discomfort, and shortness of breath as the fluid pushes up against your diaphragm. Ascites often appears alongside other late-stage symptoms, like leg swelling, peripheral edema, and liver enlargement, hepatomegaly, all pointing to advanced right-sided or biventricular heart failure. If you notice your abdomen gradually enlarging or you're feeling heavy, full, or short of breath for no clear reason, act quickly. Don't wait for it to worsen or assume it's just digestion. This is your heart sending a serious signal. Prompt medical attention can relieve symptoms, prevent dangerous complications, and help bring your heart back under control. Heart failure doesn't happen overnight, it builds quietly. Your body gives you clues long before it's too late. Breathlessness, swelling, fatigue, sudden weight gain, they're not random. They're your heart asking for help. So, listen. Take notes, track your symptoms, and most importantly, talk to your doctor early. With the right diagnosis and care, heart failure is treatable and manageable. Many people go on to live full, active, healthy lives. You deserve that too. If you found this video helpful, like, share, and subscribe for more evidence-based health education. And remember, your greatest protection is awareness.